So, good morning, all. Today's topic is very interesting, and we are going to discuss about mind-body-spirit connection in diabetes care. So, let's start with this case scenario, which we had published in IJDDC. We had received one type 1 diabetes patient. He had been advised to take insulin almost 3 years back, but he had refused, met some so-called spiritual guru who had told insulin is not good for him, and he had stopped taking insulin and also not visiting us. But almost 3 years or 4 years back, when he came to our hospital with ketoacidosis, we had treated. Then we had a very gentle counseling. The patient caregiver, family members understand what they had done was wrong. And we also counsel the patient in a way, in a language the patient can understand. And we had taken certain references from our ancient wisdom, Bhagavad Gita. And very importantly, all of us who are treating patient, we need to remember this sloka. Yomam pashvanti sarvatra, sarvang cha mai pashvati, tasyahang na pranashyami, sa cha me na pranashyati. For those who see me everywhere and see all things in me, I am never lost, nor are they ever lost to me. So, with this concept, with this perspective, we always try to serve our patient. And here, our main job was to treat glucose urgently. Emergency care had been provided. And then also it is important to plan for the chronic care so that he will not stop insulin again. So treat the person continuously. That was again our another goal. So when we talk about spirituality, and we need to remember, it should depend the will to preserve life, not replacing insulin in type 1 diabetes. So we did not reject the patient's faith. We try to enter the patient's value system with respect. And then it is very important to understand the spiritual counseling is also like modern medicine. The basic theme of modern medicine is one dose not fit for all. One spiritual counseling, one standard spiritual counseling is not fit for all. It should be customized depending on the patient need, patient's perception. With our counseling, the family saw insulin not as opposition to faith, but as a life-saving instrument of care. So how we convert the confrontation to adherence. So if we talk about today the definition of health, maybe it is a 50 years old definition or few years more older. Physical, mental, social well-being. So when we talk about our ancient wisdom, if we start from Dhanvantaris and the Dhanvantari Deva, then I think almost 5,000 years, our tradition is teaching that the basic principle of health is not to restore the physical well-being only, to restore body, mind, behavior, environment, and spirit. So this is about Dhanvantari's pot of nectar. So in modern era, we are talking about a lot of GLP-1 things, dual agonist. Now triple agonists are also coming. But if we try to understand the chariot, dopamine, and GLP-1, where we can say ancient wisdom meets modern appetite biology. We all know what Katha Upanishad telling us: body, the chariot, senses, our horses, mind are those reins, intellect is the charioteer, and we, the self, are the passenger. And if you talk about modern neuroscience, which taught us palatable food activate that dopamine, especially acting on those nucleus accumbens, prolong the hedonic eating, even when physiological need is low. And we are using GLP-1 therapy, which can suppress this dopamine-linked palatability response, but reward circuits, again, oppose this satiety signaling. So this is what we want to impress upon, the chariot self-regulation from Katha Upanishad. The self is the passenger, intellect is the charioteer, mind is the reins, and we have lot of senses. It could be palatable food, it could be late night eating, stress, different type of sensory temptation. They are pulling us away. But if we have self-regulation, if we have reins in a stronger way, stronger hand, like mindful eating, disciplined routine, purposeful living. So these uncontrolled senses drive behavior, trained attention guides action. So that is the ancient wisdom. And here we can see how the hedonic eating circuit occurring. In a similar manner, we need to control that hedonic eating circuit. And there we need to integrate this concept of whole person care, where there should be a healthy lifestyle, of course, evidence-based medicine, mind-body practice, and spiritual resilience and meaning. So this spirituality actually supports treatment. But please remember, it must never replace any evidence-based therapy. So the dialogue should start with empathy, along with cultural competence, trust restoration. It should focus on medication adherence, mindful eating, reduce stress biology with yoga and other exercises, and that will lead to better outcome. So if we have weaker reins, so our senses, those horses, those reward circuit, the dopamine, the hedonic eating, the energy excess, more insulin resistance, more inflammation, more adipokines, harmful adipokines, and ultimately we will have bad CKM outcomes. But if we make the brain strong, mindfulness, intellect, meaning, self regulation, and wise choices that will improve adherence, and ultimately we will have a good quality of life and improved metabolic health. So, GLP-1, of course, it treats satiety biology, we need to acknowledge, but mind body practice trains those reins. And spiritual resilience sustains adherence. Next important part is, are we treating disease or only managing numbers? So, the root cause is not one cause. It is the network behind the disease. In type 2 diabetes, we may target different type of outcomes, be it HbA1c, be it CGM carbs, with new GLP-1 GIP agonist, SGLT2, some insulin algorithms we can use, digital twins, risk calculators are now available. We can use them all. But when we talk about root cause approach, I think we need to ask few questions. In a patient, why insulin resistance is there? Why there is visceral adiposity? Why late dinner? Why sleep deprivation? Why chronic stress? Why sedentary life? So all these why are important. Why loneliness? Why poor medication adherence? We have many therapeutics options that can lower glucose, but root cause medicine asks why glucose dysregulation happened, why it persists, and why relapse occur after treatment withdrawal. So the forgotten foundation of healing, which had been proposed long back by our ancestors. If we talk about this 8 pillar, 8 spokes, starts with ahar, bihar, aushadhi, vichar, ব্যবহার, including behavior, sleep, stress level, parivar, the family support, samaj, society and policy, prakriti, how to promote individualization. So all these balanced outcomes, we can achieve a good quality of life with equity and resilience, and both glycemic control and cardiometabolic protection. And this was the 1 week spoke clinical workflow. If we can understand among these 8 spoke, which is the weakest spoke, then we can choose one micro action. For here, after having a person-centered review, there could be certain concerns, integrating the clinical data, life context, expectations, assess these 8 spokes, then identify the weakest spoke. List up supported domain at this visit is maybe the vichar. Then we can target that spoke and choose one achievable micro action. It should be smart, specific, measurable, realistic, achievable, and time bound. So ahar, that means reduce the evening rice, add some pulses or vegetables, 10-minute walk after dinner, just tell the patient, fix certain mixed dose barrier, why the patient is not taking. Maybe the statin cost is little high, just lower the cost of the statin. Maybe you choose certain generic statins. sometimes you need to intensify if it is not controlled. Regular sleep or medication routine check when the patient is going to bed, when he is stopping the mobile phone screening. If he is checking his mobile up to 11 or 12 in bed, then ask them to just switch off mobile maybe 2 hours before going to bed. Then, after all this micro action, after some time, you have to monitor the response. What about to glucose? How the behavior changes regarding the symptoms, moods, experience, and each visit you have to check about the progress. And according to that, you have to adjust the plan, reassess the wheel. So, when we talk about ancient wisdom, yoga, I think Veda and Upanishad. From Veda, the Upanishad, and then we have that yogic philosophy. And in Atharva Veda, we got Ayurveda, and we know about the Panchabhut and our physical body and this Panchabhut. What happened if any imbalance occur? Some doshas, along with mental constitution, guna, satta, raja, tama, how these alignments are important, and depending on that, the specialists recommend yoga or different ahar. So yoga is not only one type of physical exercise, it is about a certain dietary pattern, certain behavioral modification like vichara, and other lifestyle modifications like sleep and physical activity. So it is a complete well-being of physical, mental, social, and spiritual. So yoga means how we are awakening the higher intelligence, controlling the lower mind. We are strengthening those brains. So, why yoga is more than exercise? There are different components of yoga, like asana, which actually important for building strength, flexibility, muscle glucose uptake, pranayama, which restore the dysautonomia, so maintain the autonomic balance, reduce sympathetic tone, dhyana or meditation, reduce stress, emotional regulation, relaxation. This help in promotion of sleep, reduce cortisol level, and in diabetes, we can have a good fight against diabetes distress with these relaxation techniques. Mindfulness eating, that is very important to modulate the eating behavior and adherence to lifestyle modification advice. Discipline or routine are important part of yoga, which actually help us to get a sustainable lifestyle change. We need to remember yoga is not merely physical activity. It is movement plus breathing plus attention plus behavior training. And we know the mechanism of yoga, how it helps in immunometabolic disruption in type 2 diabetes, how it reduces insulin resistance, how it reduce pro-inflammatory cytokines like interleukin 6, TNF alpha, 1 beta interleukin. So actually we get a balanced metabolic health. This is a paper which had shown the mechanistic benefit, how the systemic cytokinemia, or we can say the higher pro-inflammatory cytokines, can be addressed, and their effect in the molecular level, that also can be targeted. Even the nuclear receptor, how they're entering into the nucleus, that path can be altered by yoga. Not only that, we know the CLAT4 transport is important, and that is very crucial for countering the insulin resistance. That also can be done, and it promotes glucose uptake, fatty acid oxidation, and very importantly, it also reduce all pro-inflammatory cytokines which actually aggravate the insulin resistance. So we will have better insulin sensitivity. So in nutshell, yoga practice induces certain behavioral changes, psychological changes, and physiological changes, which are crucial to prevent and control of diabetes, body weight, blood pressure reduction, lipid profile improvement, prevention of different type of worst cardiovascular outcome. So it acts on that sympathetic nervous system hyperactivity level, hypothalamo pituitary adrenal axis, so that the stress hormone become reduced, less cortisol, more melatonin or endorphin, less prolactin, less growth hormone. The growth hormone actually it acts in a different manner, not direct inhibition, not direct decrease. So ultimately what we will have an improvement in cardiac autonomic function, coagulation profile, nerve conduction, and cognition. This is one of our review article which we had written, where mindfulness eating as multidimensional therapeutic practice, how the integration of the neurobehavioral science, lifestyle medicine, and our own philosophical traditions actually help in better diabetes management, we had shown. When we are concluding today's presentation, I think every conclusion done with arati, because if you just remember our ancient culture, the arati is the last step of every puja. We did arati and we finish our puja. What is arati? Arati is the Vedic mantra of alignment, consciousness to physiology to metabolic health. We all know Tamasoma Jyotirgamaya. It reminds us that human being is not only biological but bio-psycho-spiritual. How? Because if you talk about Aratrik, it has 8 dimensions of human existence. 8 dimensions. What are they? 5 Panchabhuta. We know Panchabhuta: earth, water, fire, air, ether. Earth, that means we, during the arati, what we offer? Flower. So that represent earth, that represent our physical body. During arati, we offer water, so it represents water, the biological flow. We use ghee lamp, and that signifies the fire of Panchabhut, Agni. So it, in human dimension, it is about metabolism or energy. Then we use that yak tail fan, the air. Bayu. Bayu is actually representing our breath, life force. Then finally, the bell sound that represents ether. And in human dimension, it is about our consciousness. So, Panchabhuta, physical body, biological flow, metabolism, breath, consciousness. Now, while we are doing arati, we should have an emotional involvement with the deity. That is about the mind. And in human dimension, human health, the psychology is important. Mind represents psychology. Then focus. We should be focused while doing arati. So that is about intelligence, which is a part of arati. And that represents cognition. And then ego, the obeisance. There lies the identity of who am I. And when we talk about this whole care, these eight dimensions of human existence that need to be taken care of. Without that, only taking care of the physical body will not give you the result. We need to give importance to all of these factors. Coming to CKM outcome and spirituality in diabetes care, there are certain research which suggest if we engage, spiritually engage, that influence healthy behaviors critical to diabetes management. This is a very important and interesting review done in Australia, where they had shown religion and spirituality often function as protective and psychosocial resources that help individuals and reframe stressful experience, strengthen coping, and support mental well-being. So this is an interesting paper. We all know this sloka from Adi Sankaracharya. Aham bhojanam naiva, bhojang na bhokta, chidananda rupa, shivoham shivoham. So Adi Sankaracharya taught us about consciousness. Consciousness, the pause before impulse, from craving to clarity. Consciousness as a clinical resource. So, hedonic eating, distress, fear, fatigue, they are real biological experiences. But mind body practice creates the pause between stimulus and response. So, awareness is important. Awareness does not replace therapy. Awareness actually strengthens the self regulation. Again, Shankaracharya uttered this. Idaning chinmata tapo kripa napi bhavita niralambo lambodara janani kangjami sharanam. If your grace does not arise, I remain without refuge. To whom shall I turn? So, compassion, vulnerability, when we talk about every insight needs compassion, compassion of a mother, and the human being behind the biomarker only. We need to think about not only those HbA1c, urine SCR, LFT, SGPT, SGOT value, FIFO score, even the wise can feel vulnerable. Even the motivated patient can relapse. Even the well-informed patient can stop insulin, overeat, or lose hope. So compassion is not softness. Compassion is actually here adherence to technology, adherence to therapy. So from inner alignment to metabolic control, what we learn. The patient does not need judgment. The patient needs guidance, safety, science, and compassionate transformation. We need to treat urgently. In decay, we need insulin. We need to treat hyperglycemia. We need to manage CKM risk. We need to prevent complications. But at the same time, treat continuously. Trust, stress, sleep, eating behavior, adherence to therapy, meaning of life, family support. We need to think all this together to actually treat a diabetes patient. So it is again very important to note, when medicine treats glucose alone, it treats a number. When medicine treats the body, mind, spirit, then it treats diabetes. So thank you very much for listening. If you have any question or comment, we can have those. Thank you very much.